What's going on? Welcome, everybody. We are at the end of July. Can't believe it. Almost into August. Thanks for joining me. My name is Cara. I am the host of BFR Tuesday, where I spend about 15 or 20 minutes each week and just kind of chat a little bit about BFR, answer questions, share some content, things like that. I shared about our BFR online performance course, which will take us beyond rehab into different protocols for swimming, running, pre-exercise, recovery, different protocols for cycling, integrating BFR with normal exercise, high intensity training, things like that. So I put that under you should be able to see it. Oh, I guess you can. I have to share it. Let's see. How come I can't? Oh, Lewis, you can see the link at the bottom of the screen. Okay, so it is down there if you want to learn more. We're going to start that performance next August 3rd. So it's going to be every Tuesday for 5 weeks, every Tuesday in August. We'll probably go about an hour, hour and a half. I have it scheduled for an hour and a half each day, but a lot of that is for questions and other things. And let's see, what else? Yeah, that should be about it. So anybody that wants to learn more about integrating BFR for performance, you can take that course with me. And yeah, we'll go from there. So I'm going to close that out so everybody can see. It should be listed underneath, just on the bottom left corner. If you want to see it, you should be able to see it there. Okay. So what questions do we have so far? What's going on with in the world of BFR this week? If you have questions, just throw them in the chat section where everybody else is saying hello, and I'm going to say hello from Dallas. Pop those questions in there so I can answer them. Hi, Keith. Welcome. Want to come in and say hello? I'm going to bring in, the boss is here. So she just had a little procedure done last week. So we're putting her on BFR as soon as she can because she won't be able to lift heavy weights for about 6 or 8 weeks. So that reminds me, I got to write her program for her. So yep. The boss doesn't bring the whip down.
Where do you think I came in?
That's right. Always looking for me to do a little bit of implementation. Okay. Let's answer Luis. I don't know if it's Lewis or Luis, I'm sorry. Are the impacts to bone density for similar load-bearing BFR exercises similar to that of regular weight-bearing exercises that benefit bone density? So with light, sounds like Lewis. Okay, got it. Thanks, that helps. All right, so again, high intensity training is your best way to load bone, right? Because the bone wants to absorb stress. And when it absorbs stress, it grows. We can also help bone formation with pressure. So getting pressure around the bone compresses the bone and you get a reaction called Wolff's Law, which the amount of stress allows for growing of the bone or building osteoblast formation. So when they compare low intensity training and low intensity and BFR with bone, it is better to do BFR because low intensity is not enough stress for the bone itself. You're going to compare that to high intensity though. I'm always going to go towards high intensity training for any type of muscular adaptation and then augment BFR if I need to in there. So let me give you an example. Patients in a cast and I want to help growing because maybe it's maybe that bone is not coming together. So I'm going to use a cellular swelling protocol. I don't have a choice with high intensity because we can't lift high intensity while that poor person's in that cast. So we should always think about BFR as either when we can't lift high intensity loads or if the you want to supplement and not have high intensity loads like during the course of a regular season. Like, so let's say and during the course of a football season, I got guys lifting twice a week, 3 times a week, and I don't want them over sore because I don't want to give them too much volume in conjunction with everything else. I don't want to overstress their central nervous system and peripheral nervous system. I would supplement with some BFR. So think about if they can do high intensity training, they should always do high intensity training. If you need to supplement because just high intensity is too much, then utilize BFR as an adjunct. If they can't lift 40 or 30% of their 1 rep max because of injury or age or whatever else, use BFR as a standalone. Hope that helps. For my full course on developing bony formation, whether that's for osteopenia, osteoporosis, or fracture, I have a whole course in MedBridge online. And I can't remember how long it is, but it kind of talks about the different ways that we can help and the research behind bone formation. Garrett, hi Garrett. I have a question regarding isometrics. How do you implement them using the fatigue protocols? Okay, that's a great question, and I get this quite a bit. So what we use is time. So I won't use 30, 15, 15, 15. What I'll do is isometric hold, 60 to 120 seconds, 1 to 2 minutes, and then with a 30-second to 1 minute rest in between. So if I'm doing, let's say, early phase tennis elbow, I'm going to have the cuff on my upper extremity. I'm going to hold the weight in a neutral wrist position, and I'm just going to hold this position. I can either be here seated, or so a lot of times I lay them on the table because the cuff's on, and then I just prop up their arm, and they're holding the weight over the edge of the table. And they're going to do that for up to 2 minutes. Why the big variance? It's double the amount. Depends on your load. If you're not sure of the load, then you're going to use a little bit lighter load and you're going to have a longer hold time. I never let people get above about a 4 out of 10, 3 out of 10 discomfort when the tissue is irritated. So 2 to 3 rounds of 1 to 2 minutes. And I will do that probably 2 to 3 times per week. Their home exercise is the same. So it's anything that I do in the clinic, it ends up being their home exercise program. So if I do that with BFR and they don't have their own BFR cuffs, then they just do those same exercises at home. They're probably going to do it with a little bit more load. And they can either do it with a dumbbell or they can do it with a TheraBand or a resistance band. They can do it with, kettlebell. They can do it without whatever they have. So hopefully that let's see, Garrett, what about positional isometrics? Is it okay to hold with maximum effort? Is it okay to do end range isos with BFR? Sure, end range isos are fine. Maximum effort, there's no problem doing maximal effort. You just don't want, if you're talking rehab, then you don't want people in a, you don't want pain levels to get so high that you're irritating the tissue. So just be cognizant of irritating tissue. If they're not injured, you can take them to failure. I don't care, as long as you give them a few extra days of rest. And I typically won't do that in the first 2 to 3 weeks of their BFR journey, because they're going to get pretty sore in those first 3 weeks. I have zero issue with positional isometrics. The one issue I have had is I've had patients come in with like a anterior knee pain, like a patellar tendinopathy. My favorite exercise with BFR probably is on a slant board, inverted wall sit with the cuffs on the lower legs, and they're holding for 1 to 2 minutes. So you can probably see my slant board right there. Super easy. But if they haven't eaten, they're probably going to pass out. And the reason, I've had multiple patients with this, I always ask them now, have you had anything to eat? And if not, I give them something, a small snack or something, some juice. You're putting cuffs on the lower limb, you're reducing the stroke volume, so your heart rate goes through the roof in order to still maintain the same cardiac output. And it is hard on the head. So whenever we're doing more full body exercise and we have cuffs on the legs, there's going to be a larger reduction in fluid that is getting back to the heart. So the heart rate has to compensate by increasing your heart rate. So just be cognizant of that. Other than that, I really haven't had any issues. I would say that where I do the most isometrics, patella tendinopathy, I will do tennis elbow, I will do golfer's elbow. Trying to think. I'll do some planking, like on a ball. You can see my gym ball behind me. Like a reverse plank on their back, and they're doing like a glute bridge. I'll do stuff like that. Because the loads are so light, I can typically skip isometrics a lot of times and just get right into eccentrics or concentrics, but sometimes I can't. So hopefully that helps. Yeah, Garrett, you're not going to blow a blood vessel. As long as you're using the pressures that we recommend, no higher than 50% limb occlusion pressure in the upper extremity, no higher than 80% limb occlusion pressure in the lower extremity. Yeah, no blood vessel is going to blow. Yeah, there's not any, I don't know of any studies with isometrics. I kind of adopted, I don't know where I got that isometric protocol. Might have been from Nick Rolnick. Can't remember. It was probably Nick. Where we talk about just getting the tissue to fatigue. That's about the best thing. And I'm with you, Garrett. I think that I do a lot of isometric stuff too, especially with my core work, and when we're doing when we're getting patients from inactivity to activity. I'll do it with pulses. I think there's a lot of value in there. Unfortunately, not a lot of research. Yeah, you can do your own research study, but yeah, it's just a lot of work. But we can also, we've got some labs that want to do studies, and that have like fellows, like physicians that need to have so many studies done while they're doing their fellowship, and they're always asking for different ideas. So I think an isometric is a good idea. And I'll write that down in case I get any questions about what kind of studies we'd want to look at. But ultimately, we know that passive BFR works in muscle protein synthesis. We know that we know that if we can get mechanical tension, it is even better. So the more mechanical tension we can create, if we can fatigue the tissue, even better. So isometrics make a lot of sense, not just for injured people, but for everybody. Lewis, the reason that I think that HIIT is so valuable is when we're training for hypertrophy, I want to get bigger biceps, I want to get a bigger quadricep, I want to get a bigger calf. That doesn't necessarily equate to strength. So yes, BFR accelerates hypertrophy change compared to high intensity training. But ultimately, high intensity training over the long term, remember, most of the studies that we look at are 12 weeks, 16 weeks maximum. And my personal feeling is that long term, you want to do as much high intensity training as you can tolerate, and you supplement with BFR. The research is still out on tendon adaptation. There's some studies that show that tendon adaptation is slower than the muscle adaptation. So high intensity helps to train the tendon at the same rate as the muscle. There's been, I think, 2 studies on tendons that it looks like it's equivalent. So we're still vetting it out. Now, if somebody can't lift high intensity, then BFR is their best alternative. So, you know, I think that if you take somebody on a full year's set of macro cycles and you're plugging people in and you're doing strength and you're doing hypertrophy and you're doing power and you're doing speed and then you're doing weight loss or maybe in season or preseason and you're creating these blocks, I think there's a lot of places to shove BFR, but I also think there's a lot of places, if the person is healthy, to do high intensity training as well. Yes, Lewis, yeah, BFR is best as a primary modality for populations that are compromised or limited in some way. That is a perfect way to put that, and I'm gonna steal that. I'll reference you 3 times, but then I take it as my own. Garrett, yeah, even in my own experience, the higher degree of irradiation with BFR is insane. Yeah. Listen, muscle activation is going to go higher because you're pre-fatiguing type 1 fibers earlier on. So you're going to tap into the type 2 fibers, which we normally don't tap into with low intensity training. So like what I'll teach in the performance course is if we want to get somebody ready for exercise is do BFR in low intensity to prime the system without creating fatigue. And so you might do, instead of 30, 15, 15, 15, you might do 2 sets of 12 to 15 with a very light load, 10%, 15%, 20% of their 1 rep max. And that just gets people ready for training. Did I miss any? No, that looks like it's it. All right, so any other questions? We're right about 1:20 and I gotta get back to seeing patients. So I appreciate everybody jumping on. Again, if you're interested in that level 2 course, I put the link down in that corner. It's going to be every Tuesday during the month of August from 7 p.m. until 8:30 Central Time. But if you can't make it for whatever reason, replays will be available after I am finished. So that is our next step, getting this done. And then the step after that is will be more emphasis on some of these populations like ACL, rehab, and aging populations. So, all right, thanks so much. Have a great week, and I will see you next time. Bye for now.